The war has overshadowed all sectors in Yemen. Women struggle to have access to medical services because most of the health facilities have been damaged by the war. This report has more details.
Yemen, the poorest country in the Arab states region, and one of the highest countries that have violations against women, is now experiencing a complex war and humanitarian crisis. According to the UN, over 76% of Yemenis are in need for humanitarian assistance. The situation of women and girls in Yemen is very challenging, and conflict has added layers of vulnerability for women and girls, and aggravating existing gender inequalities. And in 2017, Yemen was ranked at the bottom of the gender gap. Not only that, but Yemen has earned the worst place in the world to be a woman, as Yemeni women face attacks at checkpoints if they were unaccompanied by a male relative, and attacks during protests, including harassment, arbitrary detention, and torture, and other ill treatment by the Houthi forces, and increased domestic violence. Against this backdrop, UN Women Yemen seeks to address issues of structural gender inequality and to meet the urgent needs of women and girls. In doing so, it implements a variety of projects, from assisting vulnerable women in places of detention to supporting women's rights actors working for peace. The Houthi militia has committed many abuses against Yemeni women. No freedom, no health care, and no safety. And now women's participation and leadership in the public sphere is low. Economic participation and political empowerment in Yemen at 138 of 142 countries. Therefore, Yemeni women record low levels of involvement in formal paid work. In addition, that women in Yemen face bullying and high rates of violence against them, including forced and early marriage. In this light, UN system to provide coordination and normative and program support to strengthen gender equality and women's empowerment efforts. They are working with their partners to eliminate discrimination against women and girls, empower women, and provide a relatively normal life for Yemeni women.